Hello again everyone, Dr. Saccone here with the latest COVID-19 update. Again, it's been relatively slow on new information, so I want to dedicate most of the talk on the concerns and fears with the reopening of the country. The reason I want to talk about this is because this generally gets very political and the rationale on certain ideas is never fully explained. To make things worse, there's a lot of misinformation, misunderstandings, and misconceptions about this topic. And there's a lot of strong feelings on both sides of this discussion, and what I'd like to do is just present the facts. Since we hear a lot about herd immunity, we'll talk about what this actually means. We'll look at what the flattened curves look like and the possible projections. Also, we'll discuss what's meant by the second spike and what's likely to happen when a vaccine is actually available. And what's the value of increased testing and contact tracing? Likewise, as certain places are starting to open up, is it safe to go outside, walk on the beach, go to a park, etc.? I'll give you the data. I'm going to just lay out the facts, and I'll give you a look at both sides of the argument, and I'll let you decide where you fall on the continuum of this discussion. First, as always, I'm going to start with the latest curves and projections. As we can see in the US, we see a continued downward trend in cases. You can see how there is a wave-like appearance, and that's because those two side-by-side low points are the weekends, when many places are either not testing or doctors' offices are closed and not reporting, etc. The case numbers are really only a function of testing. When we look at the deaths, here we again see a continued downward trend, and again, this is all good news. In New Jersey, we're continuing to see a downward trend in cases, hospitalizations, and ICU bed need. The deaths are also continuing to steadily decrease. Remember, when we think of the deaths as absolute number of daily deaths, they seem to really only be minimally decreasing. However, when you consider the deaths as a percentage of total cases, the drop-off is actually much more impressive. Pennsylvania is seeing its continued trend down in both cases and deaths as well, and this is great news because they really have started a partial reopening and there has not been a significant spike in cases. And Kentucky has seemed to have peaked and is on the downward slope as well. Again, Kentucky is difficult to fully analyze due to inconsistencies in testing due to its underserved and spread out nature. I've been saying in New Jersey that we should start to see things opening back up in mid-May, and that's holding true. Honestly, I don't see any reason why we can't advance these policies further by the end of the month, well, at least based on the current recommendations. So let's talk about opening back up. Now, this is a topic with some very strong opinions and feelings, so I want to cut through that and just get down to the facts. We hear a lot about herd immunity. What is this? Well, herd immunity is the process where the majority of the population has become exposed, infected to a disease, and then has antibodies against it. When this happens, the spread then decreases, basically halts, because there's so many people that are immune to it and they can't pass it along or carry it. This is the concept of why we vaccinate at all. Think of the measles. The vast majority of people have been vaccinated against it and have antibodies. So in the general population, if you did not or could not get vaccinated, virtually everyone you'd interact with would be immune and couldn't pass it to you. So you would have a very low chance of catching it. Any other unimmunized person you may come in contact with will also have a low risk of picking it up, so the chance of you coming in contact with an actively infected person and catching the disease is extremely low. Herd immunity can be achieved either directly by people becoming infected and making antibodies on their own, or indirectly through a vaccine. How many people would need to be immune for herd immunity? Generally, is around 60 to 70% of the population. And this is the neighborhood of 180 million Americans would have to be affected for this. So this is why the concept of a vaccine is much more appealing. So let's talk about the vaccine. There's been much political discussion about locking everything down until a vaccine can be developed so we can achieve herd immunity this way. I've talked about the prospects of vaccines going forward, with the earliest vaccine being ready near the end of the year. I also said that locking down until a vaccine is ready isn't really feasible, and here's why. First off, even if a vaccine was approved today, it would not be produced in sufficient quantity for a few weeks. And then after we get vaccinated, we can't say how long it'll take before we're immune. Many vaccines provide immunity in a 2 to 4 week period. However, other vaccines do need multiple doses, and we have no idea what the timetable for this vaccine is. Furthermore, even if a vaccine is available today and you're magically immune the second you get it, I don't see the majority of Americans lining up to get it. Look at the flu shot. The annual flu is consistently shown to kill people who do not get the shot, but still less than 40% of Americans get that shot annually. I don't see people willingly getting a vaccine that was rushed through the FDA without appropriate long-term safety data. Plus, There's a lot of conspiracy theories floating around and misinformation and misleading YouTube videos that are going to stop people from getting the vaccine. Studies show that 60% of Americans are in favor of the vaccine, but honestly about 30% are probably going to get it, which is far below what we need for herd immunity. I'm not trying to scare people. I will get the vaccine myself, but I may be hesitant to vaccinate my daughter. So we can't lock down until there's a vaccine because we honestly don't know even if there's even going to be one or how effective it will be. Remember when we talked about flattening the proverbial curve? This was lower the cases below the healthcare capacity, not to flatten it to zero. Since it's impossible to eradicate this disease, at least in the near future, flattening to zero just isn't possible. So there are plans being put forth that we're talking about when people speak about reopening the country. Remember, no intelligent people are saying that we should open everything back up. The only suggestions are lockdown forever or a slow, gradual reopening. The reopening plans would keep measures in place so we stay below the healthcare capacity. If you look at these curves, they show the different models. Keep in mind, both the green and the orange curves have the same number of cases. It's just obtained in different time periods. The phase that's being used for gradual reopening is what they call a controlled avalanche, basically dampening that second wave. So, what is meant by the second wave or second spike? The first wave is the initial infection spike. This was tempered by the lockdown, social distancing, the masks, etc. We effectively flattened the curve, and now we are seeing the cases going down. Now, when the restrictions start to be relaxed, people will start to intermingle and there will be an increase in cases. This will happen no matter how and no matter when we reopen. Even if there's a vaccine, we're going to see a second spike. It would be a lot smaller, but there would be a second spike. I want to keep bringing that up because you do see media outlets keep mentioning spikes in cases in areas that are reopening, and this is what we expect to see, and we're okay with it. This is really a scare tactic. It's true, but the second wave is inevitable. Then this is where the discussion of aggressive testing and contact tracing comes into play. We hear multiple people in charge saying that we need X amount of tests before we can reopen. So let's discuss testing. Testing will not eliminate the disease because COVID is easily transmittable and people are often asymptomatic. The utility of mass testing comes into question. We need to ask, what would the goal of mass testing be? Since it would not eliminate the virus, because even if you tested every single person in the United States in one day, there is a high false negative rate, and then there's that window where people are infected, but the test is still negative. So the only point of mass testing is to quickly identify hotspots and then ideally contain those areas quickly. It would also be used to protect those at-risk populations, like our nursing homes. So maybe asymptomatic employees could be identified quickly so they don't spread it. And then likely what we're seeing being done in Florida soon, you could test family quickly so then they could safely visit their loved ones in these facilities as well. But really, that's the only major benefit to mass testing. In places like South Korea, which is brought up, they implemented mass testing very early and were able to contain the virus. Well, at least temporarily, even they are seeing a second spike. But we're way past this. What I'm talking about with mass testing just isn't my feelings though. Scott Gottlieb, the former director of the FDA, has stated this, and even Anthony Fauci has said similar things about what the point of mass testing would be. So the notion of needing millions upon millions of daily tests, well, it's kind of unsubstantiated. The utility and data for needing this doesn't warrant the lockdown until then. I do think that we do need to increase the amount of testing we're doing, at least refocusing it to certain areas, mainly the nursing homes and other hard-hit areas, and then realistically have very rapid and more mobile so the test can come to the areas that may be heating up. So, what about contact tracing? Contact tracing is the idea of saying, oh, hey, you tested positive. Let's identify everyone that you were in close contact with in the last, say, 48 hours. It's being proposed that apps on your phones, etc., could monitor your whereabouts and identify which people's phones are near you in a set period of time. So then those people could be tested. Now, you can see the utility of this. You test positive, and you could quickly identify 100 other people that you may have infected. This could have some benefit, but the real question is, where is this useful? Again, this is useful to help identify hotspots. But since the majority of patients are going to be asymptomatic, the need for everybody to be contact traced leaves a little to be questioned. especially since we were going to be identifying the hotspots by the sicker people showing up in the ERs. The asymptomatic ones will never be identified, and this is who is being shown are the ones that are transmitting it. So I personally need a little more data and evidence here before I have a government tracking app installed on my phone. Now, there's the huge question about reopening the parks, the beaches, and outdoor spaces. Will it be safe to go walk on the beach, to go swimming, etc.? Like everything, there's going to be a risk-benefit calculation. So we need to look at the number of cases that have been reported from open-air outside transmission with social distancing. Wading through case reports and outbreak reports. Open-air transmission worldwide with social distancing, there has been 2 cases reported. 2. Now, I'm relatively certain that there's been more, but the risk of transmitting something when you're outside is ridiculously low. So yes, I feel pretty confident in recommending going to the beach. This doesn't mean that we have to go out and sit on top of each other and share an ice cream, but we can feel pretty safe that if we sat on the beach 6 feet away from our neighbors, we'd be pretty safe. So what are we talking about? Again, I'm not saying to break social distancing or to fire government at all. But I also don't want you cowering in fear in your home, since a lot of the data is showing that 84% of transmission has been occurring in a home setting. As a doctor, every day I lay out treatment plans. I explain the risks and the benefits of treatments. Every treatment has risks, as does choosing to forego treatment. The best we can do is understand the risks and make our own choices. And this is what's going on here. No matter what path is chosen, there will be risks, there will be deaths. There will be deaths from COVID-19 if we lessen restrictions, as there will be deaths from suicide and substance abuse if we don't. And we're already seeing this as a direct result of the lockdowns. Mind you, no one is suggesting that every restriction goes away and that everyone is forced back out to their previous life. In fact, that's a terrible idea, as is continuing to lock down indefinitely. It seems the correct answer is going to be a partial reopening, involving those people who are the healthiest and least likely to have long-standing issues, while the elderly, sick, frail, and other at risk are permitted to continue to shelter in place. If this is applied with a testing strategy to protect the at risk, we can see the population move closer to herd immunity. Remember, healthy people can die, but those under the age of 40, 2 out of every 10,000 die. The other 99.99% do very well. The amount of risk, the speed of reopening, and the amount of reintegration is what needs to be exactly determined. What risk you can accept is a function of your health, your risks, and your level of comfort. This is a choice that you get to make, and like I said, you get to decide where you are on the continuum of this discussion. I hope you found my insight and research on reopening informative. Again, try to be unbiased, give you the facts, and allow you to make informed decisions about your health and your family. Again, even if the restrictions get lifted, social distancing measures are going to need to remain in place for the foreseeable future. Let's keep it going. Stay strong, my friends. Now's not the time to ignore your responsibilities. Millions of Americans' health, lives, and jobs rely on you continuing to do your part. Take care, and God bless.